Welcome to Vital View by Adarsh and Ambati. First, onto the problem, where we see that vital signs are measurements of the body, and systems that monitor vital signs are among the most important tools healthcare professionals have at their disposal when looking after a patient. Even small changes to certain vitals can be early warning signs, and in cases where patients are unconscious, sleeping, or unable to communicate, vital sign monitoring is even more crucial. Now moving on to the goals, which were to design and develop a low-cost monitor that detects the five main vital signs of being temperature, heart rate, blood pressure, blood oxygen levels, and respiratory rate. It is also supposed to present the many advantages of being unobtrusive, a lifesaver, useful for first response officers, hygienic, sending notifications, and maintaining a record. Now we'll understand photoplethysmography, which is how we determine our heart rate. You see, as the heart contracts, more blood goes into the arteries and veins, and this more blood means more green light from outside sources will be absorbed, and less green light will be reflected back. And the vice versa is true when the heart actually expands. This creates a wave, and the frequency of this wave is the heart rate. Design overview, we can see that the Raspberry Pi captures the information from the sensors, sends it to the cloud, which computes the information and sends the vital signs to a web server, which the app accesses in order to produce what you see on the right. Next, 496 tests were conducted with 62 testers. For temperature, there was an accuracy of 99%. For heart rate, the accuracy was 69%, with an increase of 10 to 15% when in good natural light. Now moving on to the applications. It is a cost-effective screening solution for combating infectious diseases like the COVID-19 crisis in hospitals and in fields. Within minutes, it can screen all five vital signs with no contact, helping protect the healthcare professionals while also developing a comprehensive health picture of the patient. It can be also used during customs and immigration to quickly screen patients. Second, because it is comfortable and non-intrusive, it can also be used for infants and elderly to track the progressive and general diseases as well. Now onto our business aspect. First, we'll discuss the main target market, which is split up into two fields of consumer and corporate. Within consumer, we're targeting the parents of infants, which by the year 2024 will have a market worth over $2.4 billion. Now, guardians of elderly and the sick are another market, which by the year 2022 will be worth $13.6 billion. Now, on the corporate side, we're targeting hospitals, which, due to the easier than current system and the decreased likeliness of infection or contamination, are likely to buy our product. Now, as more hospitals buy our product, it'll actually help promote it in the consumer sector as well. Next, now onto our target audience analysis. We've already discussed our current market, but next we'll move on into the three main tiers of outer market regions. And first, in Tier 1, we'll be looking at the people who will shy away from the home healthcare market if nothing is done in the status quo. Next, Tier 2 are the people who are absolutely refusing to buy our product. These are people who are afraid of the Internet of Things movement due to privacy laws, as well as those who are stigmatized against self-care. And lastly, Tier 3, the people who are completely unexplored. These are people who are older, for 40 to 50, who have not yet even experienced health risks to be aware of the problem and our solution. Next, onto market competitors. First, on SmartBeat. SmartBeat failures are one that it has no room temperature, no blood oxygen levels, no cloud application, no blood pressure, and no body temperature. Owlet, which is a wearable device, fails on the fact that it is not contactless, has no breath rate, no blood pressure, and no body temperature. Now, regular baby monitors don't even check vital signs, but also most of them aren't even an application based. We'll look at what we're doing to elevate ourselves. We're 1. Eliminating the need for contact monitoring that can irritate the patient, and the need for multiple vital signs monitors. Next, we're reducing the modes of monitoring to just one single portal, the app. And finally, we're raising and creating a whole new system. In fact, we're raising the efficiency of the devices by incorporating multiple vital signs, and the accuracy of an emergency alert through many vital signs detections. We're also creating a streamlined, cheap home healthcare device that can have built-in songs and lights to calm a patient down, as well as other tools besides the vital signs, such as dual talk and two-factor authentication. Now moving on to the validation, this company was selected to be part of the Paraventure Capitalist Garage Bootcamp. and it also won the following awards. For example, it won top 30 of the Blue Ocean Pitch Competition and won grand prize at the National Raspberry Pi Competition. Thank you for listening.